Hello, everyone. I'm Natalie Kunzman, MD, and today we are talking about heart disease. Now, heart disease is a very loose term that some of the lay public will use to describe various different problems with the heart, but specifically today, I'm going to focus on the coronary artery disease, heart disease, which is the clogging of the arteries and the plaque buildup that can slow or stop the blood flow to those arteries that are supplying our heart of its blood supply. And if they are blocked, it can get compromised, and this can happen for several reasons. So we'll get into the very quick anatomy of the heart, which has the muscle that pumps, the valves that will allow blood flow through different chambers of the heart. There's also an electrical conduction system. And then there are arteries that are surrounding that heart, which supply that heart of its own rich oxygen supply. So let's say you have heart disease or coronary artery disease. What symptoms might you have? You might have the obvious chest pain or discomfort. And when it is cardiac based, we call that angina or angina. You may feel weak or lightheaded or nauseous or feeling sick to the stomach or actually breaking out in a cold sweat or what we call diaphoresis. You might have pain or discomfort in one or both of the arms or into the shoulder. You may have a shortness of breath. You may feel dizzy. You may have a diminished exercise capacity. And unfortunately, some people's first symptom is the heart attack itself. So, what things contribute to coronary artery disease or heart disease? Well, one known factor is being overweight or obesity, physical inactivity or a sedentary lifestyle, diabetes, unhealthy eating, such as a lot of processed and grains and carbohydrates, smoking tobacco. Now, a family history of heart disease also increases the risk for this coronary artery disease, especially if there's a family history of somebody having this heart disease at an early age of 50. But I need to remind everybody, if you have gotten nothing else from my lectures, you need to realize that genetic makeup is 10 to 15% of your potential for any disease, and 80 to 85% it's lifestyle, which can be modified. So there is always hope, and our efforts can always pay off. Another contribution to coronary artery disease is excessive alcohol intake, smoking cigarettes, and there are some common subsectors of cultures and races that might be a little bit more predisposed. However, living in the United States itself is one of the leading causes of coronary artery disease. Now, when you come to my office or when you see a cardiologist, there are several different ways that we can actually start investigating that heart and if you have this. One is an electrocardiogram, which is an electrical snippet in time. There is an echocardiogram, which I absolutely love, which is an ultrasound-based technology that can actually look at the pump itself. Are there areas of that heart that are deprived of oxygen? And it will also look at the valves to make sure they are functioning properly. There are several different types of stress tests that we can do, such as walking on the treadmill and looking at your EKG, or walking on a treadmill and checking your echocardiograms. And for those people who cannot walk at all, or there are some limitations to being on the treadmill itself, there are chemically induced variations of stress tests. We can actually do an angiogram, where we can shoot dye in the arteries and look at them. Or some newer technology, which is CAT scan based, is the calcium score, which can give a numeric score to the amount of calcification that is building up in the artery, which is indicative of coronary artery disease. Then, of course, we can have a catheterization, which will look at those arteries. So once that we know that there's some underlying coronary artery disease, we may need to have some aggressive treatments in my allopathic world, such as medications or stents. And stents are straws that get put in the surrounding coronary arteries to keep them open. Or more aggressively, a bypass surgery may be required, in which veins or arteries are used to bypass those arteries that have disease and are blocked to create other routes of oxygenation to the heart muscle. So I have to use many of these tools when the cat is out of the bag, but the most important is the prevention of coronary artery disease. So what things can we do to prevent heart disease? One is stop smoking, and you will find this in most of my lectures. The other is to get moving. I have so many patients who are worried about starting an exercise program for fear that it is harmful, but it is just the opposite. I need you to get moving at least a half hour daily, but the body would love even more. Now, sugar and diabetes is one of the biggest risk factors. And the way I like to describe this is, if we have sugar clustering up on our red blood cells, which are supposed to be nice and slippery, unfortunately, that stickiness of the sugar around that red blood cell will now try to squeeze itself through a capillary, and it is like a cat of nine tails, which is scratching and irritating and causing damage to that arteriolar bed. Sleep is important to get our growth hormone stimulated at nighttime, and that growth hormone helps us with our cellular repair, and not only that, but keeping our cortisol levels or our stress levels low. The diet really needs to be much more of a whole foods, much more vegetation, eliminating processed chemicals, and no sugar. A lower salt diet might be needed to slow down or quiet down elevated blood pressure. And of course, helping to control the blood pressure, which is also a risk factor for heart disease, is important. Now, we need to get to the ideal weight, and it can be very complicated or it can be very simple. But obesity is a pro-inflammatory condition. It actually is stimulating portions of the immune system that recognize injury, and then it will send out a pile of inflammatory cytokines or inflammatory proteins to those areas that it views as inflamed. So some of these cytokines will travel to the fat cells, the liver, the pancreas, the brain, the muscle structures. The arterioles themselves are lined with a muscle structure. And then there are macrophages and T cells that will actually go and create some of this inflammatory response. So please, let's keep our weight down. While we're still talking about prevention, I need to make some comments about cholesterol. We need a very quick tutorial on this. Cholesterol is not the enemy. Cholesterol is needed, and it's manufactured in our bodies, usually at the liver level, for several compounds, including our sex hormones such as testosterone, estrogen, and progesterone, and vitamin D. But it also helps create our cell walls and our myelin sheathing that is in the brain, such that 40% of our brain is made of cholesterol. the biggest influence on blood cholesterol is the mixture of fats and carbohydrates that are in our diet, not the amount of cholesterol that you eat from food. Now, lipoproteins are needed to carry that cholesterol, otherwise it would be buoyant and floating. So these lipoproteins, which are your HDL, good cholesterol, LDL, bad cholesterol, they are needed to attach a protein to the cholesterol so that we can carry it through the bloodstream. And that some of those may be pro-inflammatory or cause problems to the arteries. For instance, if you make the type of LDL that is very small and particulate, very small particles, that behaves as BBs that are going along in that artery and causing damage. But if you have the big, buoyant LDL particles, think of those as beach balls floating through the arteries that are just moving along and not causing any damage. So what I usually like to do is check for some of the newer lipoproteins, and one of those is lipoprotein A. We're discovering that those patients who have a higher lipoprotein A may have a higher risk of having coronary artery disease. And if I see people like that, I may stress test them earlier or get them even more aggressive with their diet and lifestyle. There is an apoprotein B, which might be more of a propensity towards strokes. To that note, since we're talking about the inflammation of the artery, I will also check a CRP, or a C-reactive protein, that has a high specificity to the artery itself. Okay, we can do energetic work, and in the metaphysical arena, the heart has been associated, or let's just say the right side of the body has been associated with physical energies, and the left side of our body has been associated with emotional energies. So it shows that if you take everything to heart and have low self-worth and deny your needs and focus on other needs, this may be a portion why people who develop heart disease can talk about emotional exhaustion, and sometimes we view that as a fear of being unloved. And again, this is a metaphysical heart relation, mind, body, spirit relation to cardiovascular disease. To that note, energetically, the heart has the highest metabolic need and the highest energetic field, literally requiring a lot of energy and a lot of ATP to operate ideally. We are energetic beings. The heart energy, or positive heart energy, is that is simple, welcoming, loving, all giving, all receiving type of energy. It is a very broadband vibrational energy. Now, the opposite to all that is anger, rage, and things like that, but we want to focus on heart energy to the best that we can. Diet plays an important role, getting back to the vegetative, green leafy vegetables, nuts and almonds, fatty fishes, which are helping to quiet down the inflammatory cascade, fruits such as strawberries, blueberries, cherries, and oranges. And we could probably spend 3 years on optimal nutrition for the heart. So again, this paints a thumbnail picture of coronary artery disease and those things that we can do to prevent it. Again, I'm Natalie Kunzman, MD. Subscribe to my channel below. And until we meet again, be well.